What's going on, guys? Welcome back to W.D.Y.D CSP. What do you do as a central sterile processor? Alright guys, today I'm going to continue with the inspection and testing of some surgical instruments, and I'm going to do a couple cutting instruments here. So I am going to do a sharp curette, Sims curette. I'm going to go ahead and do a oval curette or cup curette, right? And I'm gonna do a straight osteotome. Okay, so first and foremost, with the vaginal curette, what you want to make sure is that when you inspect for cleanliness, you're inspecting the cutting, right? Any dried on soils, you want to look for any chips. Again, use your lighted magnification, right, to look for any indentations or burrs or dents within that cutting edge, right? You also want to check, because this is actually welded here, you want to make sure that if it does have a weld point, that the weld point isn't cracking or breaking. You want to make sure that everything aside, this is a hollow handle, so make sure that there's no breaks in the base or anything, especially in the proximal end there. I have seen pinholes in these handles before that accumulate water. So overall, very good. Okay, we're going to move on to the curette here, the bone curette. So you're going to make sure, same thing, use your lighted magnifier to look at the shape. You should also see if this was overly sharpened or repaired, so you'll see a very shallow indentation. It should be like a little spoon, right, a little cup. Same thing with the shaft here, looking for any cleanliness, dents, damage, or stains. For the osteotome, again, this is just looking one solid piece of metal, looking for any uneven cuts or sharpening where there's a slant if it's not supposed to be slanted, looking for any burrs or staining on the device. Now, to test for functionality, these are all sharps, so you want to do what's called a sharpness test on it. Okay, again, if you do not have one of these books, you can ask your vendor what can be used, but this is basically how you're doing your test, right? You're using this little plastic dowel rod here for that type of test there. Alright guys, so sorry about that. So this dowel rod is used for different, this little dowel rod, which is a little plastic rod right here, is used to test like your liston knife. You can use it for gouges, okay? Any kind of osteotome or chisels, okay? And of course your curettes. So the way you do this, and hopefully I can show you this on screen here. Let me adjust here a little bit. There you go. Alright, what you want to do is always place your finger on the proximal end of the rod, the one closest to your body, and you want to hold this rod down securely. Okay, what you want to do is, I want to show you, what you want to do is always work away from your body and your hands, never towards your body. Okay, so what you're going to do is you're going to kind of hold this like a pencil, and what you're going to do is rest it on your finger to kind of do like an angle on it. Okay, and you're going to push into the rod, and it should bite off and actually slice off little pieces of that plastic. If it slides very easily and you can't bite into this rod, this is a bad chip. This is a bad osteotome. Okay, at this point right now, this is a good osteotome. Remember to always wipe off your excess. You might want to grab a towel or something. Okay, you're going to do the same thing with your curettes. Your curettes you're going to face downward, okay, because and you're going to use it as, you can use it as a scoop, okay, to go away, but you can also do downwards and do the same thing. Rest it on your finger and try to bite into the dowel rod. If it bites without slipping, of course it's going to slip to the side. Again, that's why it's important to go away from your body. If you're on the dowel rod, yes, it's important that you rest it, okay, and it bites, okay. You can also do this the other way, like a pencil, and kind of come here and try to bite to the side and pull. Again, wipe off the excess off the curette. Lastly is going to be your curette. Now this one here, you can do the same thing, but what you want to do is actually you want to scrape away. So you're going to hold and you're gonna actually use your thumb, okay, to be on the back of that curette, and you're gonna bite into your dowel rod, okay? And if it bites without slipping, this is a good curette. Again, wipe off your excess from your head. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself. Till next time, peace.